What is the main cause of bad breath?
I'm brushing my teeth every day. Maybe I even use a mouthwash, but I still experience a lot of bad breath in my mouth. I'm gonna plug a lot of people because I was also plugged onto this. I didn't know this before. But if you go on now, maybe on the internet, and you're looking to buy a dental chair, you need a dental chair.
What is the minimum that I need to be looking at, and what are some of the challenges that I have to look out for in this inception of the new practice? When do you remove over repairing, or when do you repair over remove? Sometimes we do
Yeah.
have this Kaiser chiefs type of a teeth. What normally causes that? Is that the normal color of my teeth, or does it mean that maybe I'm eating a lot of raja in some way?
There are two things to that.
There is this thing we call wisdom teeth. I mean, when do people get them, and why do they come very late? And is it a myth or a fact that they really come with wisdom? Does that mean that we are dumb throughout the years? What's happening, everybody? Here's your favorite Mr. Cator with another episode with Kentiko Kenneth Chivase. Today we're going to be talking to our Dr. Chivase. Okay, that was a very good a correction, Dr. Chivase. And we're going to be talking to a dentist today. And we're going to learn a lot around what obviously a dentist is, all the way to the myth and the interesting stuff around the dentistry industry. Maybe just for a start, can you just maybe go ahead and maybe introduce yourself a little bit, and then we can just jump on it?
Okay. My name is Kenneth Chivase. I'm a dentist I grew up in Venda. I'm 100% Venda. Yeah, Mr. Cator is my brother as well. So yeah, just to get a sense of where this whole thing come from. So yeah, I'm Dr. Chivase, dentist, currently practicing in Joburg, also in Mamelodi, private surgeries only.
Nice stuff. Nice stuff. I think maybe we can just go straight to it because I didn't want to waste time here, right? Can you just give us a glimpse of what may be a dentist and what do you guys do? I mean, most people know to visit a dentist only when they need to clean or remove their teeth. I mean, do you guys have
Yeah.
anything additional to do other than that?
Dentistry is a very, very large scope. Like it covers a whole lot of stuff. So I'll just maybe some of the words may be a little bit professional, but I just want to be able to explain it much better. So what most people know, obviously, it's minor oral surgery, which is mostly just teeth extractions, which is removals. Most people come to us when they have a toothache, and we have to remove them. But we also do have teeth cleaning, as you mentioned there before. Teeth cleaning is just a matter of cleaning your teeth. But what most people confuse teeth cleaning with is teeth whitening, because teeth cleaning and teeth whitening are two different things. So basically, teeth whitening is more bleaching of your teeth, if I can put it in simple words. But then, yeah, that's one of the things that we do. We have what we call orthodontics, which most people may say braces, So with orthodontics or braces, that is a part where it focuses on teeth alignment. If your teeth are sort of like crooked, the other one is forward, the other one is behind, and you just want them to be on a straight line, then you need braces to move those teeth. So it's nothing surgical or anything like that. So that's just another thing that we do. We have teeth restorations as well, which most people might say patching. I would say so. Most of the time, people have holes in their teeth, and maybe which is why sometimes we remove them. But before we could remove them, we would probably patch them so that we save them. We sort of like save them safe from removing them in a way. So it's a whole large scope, which some of the things that we do is working inside the tooth, which we call endodontic as well. But yeah, I would say briefly that's what a dentist does,
Okay. I think maybe I would like to just follow up on some of the things you spoke about, right? You spoke about removing or repairing. When do you remove over repairing, or when do you repair over remove? Because one of the reasons why I never wanted to go to a dentist before or when I was young, Hey, I
Yeah.
don't want my teeth to go out. I remember there was one interesting story with my mom. I kept on saying, "Hey, I thought the and it was a very big
Yeah.
fuss." So then, when do you guys remove and over repair?
Well, so each and every tooth
Mm-hmm.
has senses in a way. So on each and every tooth, there is a nerve inside it. So that nerve will feel pain, will feel hot, will feel cold, with anything that might be presented onto that tooth. That same nerve, if I tap your tooth, then you can be able to sense to say, okay, this is the tooth this guy is tapping, or you can be able to feel the nerve, basically. So now,
Sure.
when I look at a person's teeth, all I see is the white parts, which most we call it enamel.
Yeah.
So that enamel or that white part, when I look into somebody's teeth, it's there to protect the nerve that's inside, right? So I just want to start there so that it's understandable
It's
when
very
I
clear.
explain where we need to repair or why we need to remove. So now,
Okay.
let's say your tooth has a hole and say it's not yet painful. You can see the tooth has a hole, but you don't feel pain at all. That should only mean that your pulp or your nerve inside the tooth, it's not yet exposed on the outside. Then that is
Okay.
the part where we restore or we repair that tooth because it's not yet painful. So basically, there's still enough enamel still protecting that nerve inside the tooth, right? But as soon as your hole is deep enough to then cause pain, it then means that we need to remove that tooth because it's in a way an irreparable. We cannot put a restoration or a patch on top of the nerve that will still feel pain and whatsoever. So that's the only time then we need to remove it. So I spoke about endodontics before as well, which is what I described as working inside the tooth. So basically,
Sure.
endodontics is also a repairing procedure, which the nerve that I just talked about inside each and every tooth. We go inside the tooth, we remove that nerve basically, and then we repair the tooth inside where the nerve was. And then
Sure.
we can then repair the tooth on the outside as well, the white part that you see. So that's just another part to prevent a removal by restoration. Even though your tooth has a very, very deep hole, or if your nerve is also exposed on the outside. So the only part maybe where we can say this tooth cannot be restored, it's when the whole part, the whole white part that you see on somebody's teeth, it's no longer there. So basically, it's just the roots that are left inside your gum. Then that way we can neither do restoration or endodontics. So we only resort to then removing that tooth. Yeah, I hope it makes sense.
Yeah,
I hope it makes sense.
no, it was very clear. It was very clear. But I want to put this in simple language that anyone who's sitting at home can be able to sort of
Yeah.
self-diagnose, so that they already know that, okay, I need to get this removed first or sort of get repaired first. Are there different pains or different symptoms that I get to experience when maybe my teeth is about to be removed or not, or I can't be able to tell that? I just need to sort of rush to the dentist anytime maybe I'm feeling something weird in my mouth.
So basically, whenever you start feeling pain, and remember I told you about the nerve inside. So as soon as
Sure.
you feel pain, that should mean that it's either your tooth is infected or you have a hole and your nerve is exposed to the outside. So anything that touches your nerve. So if food is getting into the hole and it's touching the nerve, then you will feel pain. But sometimes the enamel is still enough to be repaired, but you feel pain. So the very first time you feel pain, that's when you need to hit the dentist and say, "Please check my teeth. I think I feel pain." So don't wait too long where you feel pain now and then 3 months later you feel like the pain is gone and then you go back to the dentist. I mean, you feel pain again and then you think it's still nothing major. The very first time you feel pain, go to the dentist. The dentist will be able to determine whether this tooth needs to be removed or it can still be repaired. So sometimes you don't really need to feel pain. Sometimes people know they have holes in their teeth, but they will tell you that this tooth is not painful. So that is those are the teeth that we can say we are repairing or we are restoring. So I wouldn't really say there are other symptoms where you could know whether this tooth needs to be restored or repaired or removed. But I would just only advise that on the first day that you feel pain or you feel some discomfort in your mouth, go to the dentist and find out really if this tooth is still savable or if this tooth needs to be removed. Most of these things we also see from an X-ray, which we take then at the dentist. So I think that's what I would say regarding that one.
Nice. I would like to move a little bit around that topic, right? But then still talk about the fact that maybe I've never seen a dentist in my life, right? Like as in, okay, today I'm going to see a dentist because I know this is the problem. I mostly just go for a general doctor, and then I don't know, we don't know what happens from there, and then you just sort of get help. Does then this maybe pose some sort of a threat or scarcity in the dentist position? I mean, does it mean that you guys don't really have a lot of job? Or, I mean, how can people sort of view it in that way? Is there scarcity? Is there less of you guys in the hospitals? What is really happening there? Or we just don't know, maybe.
Yeah, I would say mostly public hospitals. I've worked in a public hospital before, but it was just for 1 year. And from my own experience, all I was doing there was to remove teeth, to be honest. So if somebody was to come to me at a public hospital and they wanted to clean or they wanted to patch their teeth or anything else than removing the tooth, I wouldn't be able to help them. And I think that is why today I'm not working at a public hospital, because I would lose all other skills to restore a tooth or take an X-ray, because really what I was doing was just to remove teeth. So I think most public hospitals, all they do, or if they do have dentists, all they do is remove teeth, to be honest, which does not promote any health to the patient or, to the clients and things like that. So I wouldn't say dentists are scarce, but most treatments you will get in public hospitals or public dentists. So those in public, what they will give you is to remove teeth. So I've been to one hospital as well, just wanted to see what was going on. It was a public hospital. Mostly the dentists there, what they do is they inject the whole line. So the last one who was last injected will most probably feel pain, because if you have 15 people waiting for you, then you inject everyone. The first one you remove, the second one you remove. By the time you get to the 15th patient, you might find that the injection has worn off a little bit. So those are some of the disadvantages, really. I wish these public hospitals or just the government in general could build
Takes
a
a look at
whole
it.
lot of
Okay.
facilities around dentistry in hospitals. So they are not scarce,
Sure.
but what they are tasked to do mostly is just removing teeth in public hospitals. But in private, you will most probably get everything.
Nice. I mean, just for disclaimer, we're not trying to paint any institution bad in this way. We just sort
not
of
at
want
all.
to understand some of these things. So then would you say it's a problem of what do we call this? Resources? It's mostly used by these public sectors and stuff like that, or it's maybe the executive orders that are coming, they're controlling way too much of what you guys as dentists do? Because I thought you, as you're a qualified doctor, you should be able to take an executive decision of what you need to do with your patients and all those kind of things. And you spoke about they tell us to only remove and all those kind of things. Is it you are told to only remove, or you only have the resources to only remove?
I would say yes, because even if I would have liked to help the patient who was coming to clean or restore their teeth, I basically did not even have the materials to do that. So the machines to do that as well. So I would say yes, the resources. I don't only speak for dentistry. I just mean health in general, like general doctors as well. You will hear some hospitals saying we don't have an X-ray or we don't have a chest machine or an ECG for pregnant patients, So I would say it's just a lack of resources, to be honest. Mostly public hospitals, they don't really have the the updated equipments to do these procedures. So it becomes very, very difficult if I'm a dentist, I'm in a public hospital, and I want to clean somebody or I want to do teeth whitening. I just think maybe, I don't know, but maybe they regard some of these things as, fancy or,
luxury.
I don't know. Yeah, like that. Yeah. So yeah, I would say it's lack of resources. Yeah.
Yeah. So then I think maybe when you go to a dentist in those institutions, you just need to know that, hey, you're going to make your smile less charming. Just know that you're gonna get some tooth removal, even if it's like a small thing, small hole or whatever. Did you know that you wanted to be a dentist before, or did you wanted to do like maybe a general practitioner, like a normal doctor that other people are doing? And maybe how did you find it when you started the university as well? And how did it start about? Like, just tell me through from the day you thought, hey, I want to be a doctor, but this type of a doctor. Yeah.
Okay. So I know when I was young, I've always wanted to be a doctor. In creche, they would always ask you, what do you want to be when you grow up? Things like that. And in all the creches maybe that I went to or wherever I was asked, I've always said I wanted to be a doctor. But to be honest, as a young guy, I didn't know much about dentistry or being a doctor for teeth in a way. But growing up, I remember in my matric, I was starting to apply in universities and things like that. I've always wanted to be a doctor, but in grade 12, I decided that I don't want to be a general doctor. I don't want to focus in the whole body. I want to focus at a specific thing, of which, even though I had gone the route of being a general doctor, I was always gonna go and specialize so that at least I can focus on maybe lungs only, maybe, things like that. Because I've always thought to know the whole body, it's gonna be challenging in a way. So in grade 12, when I was busy applying, I came across this dentistry thing and I was like, this could be interesting because you're still a doctor, but you're only focusing on teeth. So I also remember in my form, I had put dentistry as the first option and I had put medicine as the second option. So I was a little bit more precise in terms of I really want to specialize on a certain thing. I don't want to do a general body and things like that. So I think that's where the interest in dentistry came from, because I was just thinking, okay, I'm still a doctor, but at least I'm only focusing on teeth. If maybe I was focusing on eyes or ears, maybe I would have gone that route, but that wasn't exposed to me in grade 12. So dentistry, especially with the institutions that I was applying at, medical schools and things like that, dentistry was always popping up to say, oh, you're still a doctor, but you're only focusing on teeth. So that's when I think I started having interest in dentistry as a course itself, So even the number of years you go there for 5 years as opposed to a doctor who goes there for 6 years. At the time, some would say they went there for 7 years. And I was like, nah, let me go to 5-year course, being a doctor, focus on teeth.
So the eye was on the money, basically.
I've always wanted to be a doctor, but like I'm saying, even if, let's say, I had gone to be a general doctor, I was still gonna specialize. I was still gonna focus onto one thing, just know this one thing. Yeah, obviously the money is good, but yeah, I've always just wanted to be a doctor. To be a doctor was the baseline in a way. But to specialize, that's where I was like, and if you look at dentistry, any specialty ends with IST in a way. So if I'm saying I'm a dentist, it means I specialize on the teeth. Dent means teeth. So dentist means specializing of teeth. So if you see cardiologists specialize for hearts, things like that. So yeah, I then just went the route of dentistry and never looked back.
Nice. I mean, I always promise my viewers to talk about your high school a little bit. I mean, many would suggest or would assume you were a top learner. Well, I'm not gonna say anything, but how are you balancing your books with your soccer interest and all those other things? Because I mean, in many cases, we do get to see people not really balancing all those things, and then high school becomes all fun and good. How are you balancing all those? And maybe can you just give us a glimpse of your high school as well?
You just touched on a very important subject there, because I'm a very, very, very big soccer fan. Growing up, I used to play soccer. Like, I don't know, soccer was my life as a young kid. So even before this dentistry dream, obviously, I wanted to become a soccer player. I wanted to be a professional soccer player. I remember even telling my parents to say, please just take me to a soccer school. If whatever you need me to graduate on, I will do that. But I still need to play soccer, you know? So my coach even tried to came to my house, convince my parents, but look, they were not having it. You understand? So from there, what I used to do is high school. I used to go play soccer, but I always knew that my parents want me to have a course, to have a degree or something like that. So my parents, I would say, play a very big role, because I would come back from a practice, let's say, and I would want to sleep because I'm tired or something like that. But they would always just tell me, you cannot sleep before you do your homework. You cannot sleep before you practice a math something. You cannot sleep before. As much as you want to do this soccer thing, you must remember that you must also have a degree of some sort. Because let's say in soccer you break your leg, always need something to fall back on to say, okay, now I have a professional job, I can't play soccer anymore, and things like that. So I would say they play a very big role, because as a young kid, you just want to come back home, eat and sleep from a practice or soccer practice, and you wouldn't be. So they really, really, really pushed me to just balance school and soccer. So only when it came to grade 12, I knew that my parents really want me to have a degree. They're not gonna have this soccer thing interfering. So that's when I really, really just then focused on passing my matric and knowing that I have to do well. Because as I'm saying, I was applying, and the APS scores, this is what they want. They want these points and these things. So I've always just looked at that to say, even if I want to be a doctor, I need to achieve these kind of points to be able to apply to this institution and go there. So from my own soccer career while I was young, I even have 2 medals. That's just how much I really, really love soccer. So I think I was good, I think I would have been a professional player playing in England even today. So that was what I was focused on, to be honest, to say I want to play in England or overseas. I wasn't really looking at playing locally or anything like that. So my mindset was always like, you need to go to America because of these things. I've seen players who came from nothing going overseas or abroad, things like that. So yeah, I'm a very, very, very big soccer fan, even today.
I mean, I'm sure the whole team or the whole squad was dreaming that big, right? What makes you think that your dream was sort of different from theirs there? And maybe what do you think was one character that you sort of held that you felt maybe was lacking from the other competition or other peers that you sort of had around you at that time?
Okay, so first of all, I know that I was very, very skillful. And by the age of around 16, let me say 4 to 16, obviously there were these divisions where if you are, let's say 14, you play under 16. When you're 16, maybe you play under 18. When I was around 14, the coach that was coaching me back then used to make me train with the under 21s or even the senior team sometimes. So I can't say it was coach's favor. I always believe that maybe the coach saw something in me. I know I was very skillful, and if I was put in let's say I'm 14 years in an under 16 team, I would outperform, maybe score a lot of goals, dribble everyone. It was sort of like or something like that, It was a mismatch. It wasn't really like, it was only when I play maybe under the 20s or play people who are who are who were seniors to me, basically. That's when I would start to feel that I have a challenge. I have to perform, So with doing that, with playing with the first team maybe or the under 21s, I started even becoming popular around my hometown. Like everywhere I would go, hey Kenny, hey, you are the guy who plays soccer. Hey. Things like that, which I don't think all the other players were getting. I would say maybe it wasn't special to them because they were expected to do that. You understand? I remember even my shirt, my jersey. It used to be very, very, very big. And my coach always said, this boy must wear a number 10. People who knows soccer knows what jersey number 10 means. At some point growing up, let's say I'm 16 years old, he would always say you need to be a captain, just so that other people can learn from you. So I would say I had a little bit of leadership skills. I would say I used to lead practice trainings and things like that.
Yeah. I mean, I guess even if the coach is favoring you, you need to sort of have some skill in some way, unless otherwise you own a team like other people we are seeing in the PSLs there.
No, I'm saying I never thought it was the coach's favor. That's what other people used to say, obviously, but I always believed in my ability. And like I'm saying, my mindset was always thinking, you need to go way to the top, 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 top. I wasn't even thinking of playing for Sundown locally or Chiefs. I always was thinking Premier League because I think that's the highest level. So from that very young age, I always just think I need to perform. Maybe somebody could see me. Maybe then I could go up there, but it never happened until I reached grade 12 and my parents said, no, you need to do a career that is legit and things like that because one day you will break your leg and you are out for good.
As you're talking about other people thinking maybe you were somewhat favored, I think that is a very common concept in the society that we are living in today, wherein if, for example, if I'm reaching 1,000 subscribers here on YouTube, which I will try to reach before my birthday, people will come and say, YouTube favored you, but they don't really know how many times I get to work on some of these things, right? But instead of just talking about me, putting it on the real people there, you were busy thinking about how to go to England. Other people were busy thinking on, Kenny is being favored, which means their goal or their end goal at the end of the day is not about them going somewhere, but rather it's just them comparing themselves to this next person. And if they were put in that area, it's like, okay, what are you gonna think from that point? Are you gonna then now start complaining that the coach is not looking at me in a nice way and stuff like that? It just sort of tells everybody, look at your own end goal, how you're getting to it, and what is happening along the way. Don't get that distracted. I want to jump on from that, right? Thank you very much for sharing about your soccer experience there.
No problem.
Do you think that being introduced to these bigger challenges while you were still young played a very major role in you opening your practices?
100%, because I think when I started thinking about this whole dentistry thing, this is the time where maybe I'm in university, third year, or things like that. This mindset of opening a private surgery was always there. And if you are relating it to being at a bigger challenge, I've always wanted to be the best in dentistry as well. So
Sure.
I also think in my class, there were a whole lot of older guys who probably maybe went on and did dental therapy, and now they were coming back to do dentistry. It was very few of us who were like at the same age where we are coming together just for the first time in dentistry. Most people who were coming to dentistry were older guys who had experience and things like that. So it obviously just pushes you to want to be at their level, because these are people who have been out there, who have done businesses, who have been restoring teeth, removing teeth before, but they're just coming back to do now the full course of dentistry. So dental therapy, it's sort of like Muratua dentistry, if I can put it like that. So I think it was just aligned that way.
His little brother, by the way. I'm just sort of explaining to Manand and the people.
Yeah, so I think those things were just aligned. I've been exposed to higher stages in terms of soccer, maybe, and things like that. But that shaped my mindset as well. Say, even though you are going to do dentistry, you need to be the best. You need to give your best. You need to be the biggest at the biggest level as well. So
Sure.
most of these people that I'm saying I was in class with, and they were older guys and more experienced and things like that. Most of these guys are my friends even today, because we completed the course together. So they had always just pushed me, push me. Just like maybe the guys on the soccer part who were older than me and was teaching me how to grow, how to do certain things. So I got that, to be honest. I was fortunate enough to get that even in my varsity, where I had bigger guys who were more experienced to help me in a way to say, you know what, this you can rather do it this way, this you can do it this way. But then from there,
What are the options?
I never thought I would work for a government. I thought from here I will then just go and open my private surgeries. As I'm saying, those guys were coming from private surgery, coming back to study dentistry. So they taught me a whole lot as well in terms of business, even before I even went to business. So that's when I was like, you know what? I'm gonna open my surgeries from the get-go. I'm not gonna try and get a job at the government, work. Nah. From the get-go, and I think that's what I did. From the get-go, after I graduated, I saved some money. You obviously you have to give back to the community. So they give you a 1-year contract at the government, which is called community service, you know. So that's what allowed me to save a lot of my money, because I was at a rural area in Free State where not a lot of things was happening. So I got to save my own money, save my money. And then after that contract was terminated, I was only looking to go create a job for myself. And I had a private surgery in the Val at that time.
So, I mean, if how much money are we talking about here for me to say I have it? Let's just say it's Andy. Now I'm called Dr. Cator, Dr. Mr. Cator, and I would like to also kick off my own surgery. Can you just give us a range? It doesn't really need to be it doesn't need to be an exact number. Just give us a range. What is the minimum that I need to be looking at, and what are some of the challenges that I have to look out for in this inception of the new practice?
Okay, I'm gonna plug a lot of people because I was also plugged onto this. I didn't know this before. But if you go on now, maybe on the internet, and you're looking to buy a dental chair, you need a dental chair, right? So say you go to the internet here in South Africa, you want a dental chair in a way. You will find the cheapest one around 120,000. But at the time when I saved my money, I only saved up to 100K. The reason why I'm saying I'm going to plug a lot of people is because most of my material, I bought them from China. So just from here in South Africa, I got connected to somebody in China and I was communicating with them. So for the whole material that I bought in China, the dental chair, inclusive of everything that maybe I would need to start a practice, I spent around
In South Africa, how much are you looking to pay for that 50K? Can you tell us? In China, you paid for 50K. In South Africa, maybe
for
you're sort of
everything.
paying
Yes.
500K or something.
So in
Yeah.
South
Okay.
Africa, you are not even halfway to buy just a chair. So you don't only need a chair, you need a compressor, you need cleaning materials, you need consumables, but you also need equipment. So your autoclave, for example, autoclave is that machine that you see where people, as dentists, we put our instruments just to sterilize them so that we can then reuse them as well. You in South Africa, 50K, you can't buy a chair, you can't buy anything in terms of dentistry. So I just said the cheapest chair in South Africa ranges about 120,000. So that tells you a lot. You are not even halfway, because halfway would then be 60K. So in China, really, I got to buy everything for 50K. But I still had 50K to then decorate my surgery. You know, those cupboards that you put, materials in, the drawers, things like that. I mean, you have seen, maybe if you have been to a dentist, you will see some few drawers there, some working space and things like that. So that's what I spent the other 50K for. But really, also, I had a reception space where I had to buy chairs and make those kind of cupboards as well. So I would say maybe I spent a lot because I had to cater 2 rooms at the time. So, but I would think if you had 30K and you just have to spend those cupboards for 1 room, I think you would make it. You would be able to open a whole private surgery for yourself. So around 80K to 100K, if you are gonna buy your stuff in China, then you can be an established dentist tomorrow, or you can open a good surgery tomorrow if you have 80K or 100K. But here in South Africa, just to buy a chair, only a chair, it's around 120K. So if you want to buy your stuff here in South Africa, I would say prepare 200K, my guy. Then maybe
Yeah.
maybe you could get somewhere. So yeah, that's just the difference. That's just the difference.
Nah, that's
So
quite valuable information. I think it would be nice as well if we could maybe on the comment section link down maybe where you sort of got some of those chairs, because I do know people are quite skeptical on spending big amounts of money on websites that they don't know whether this is legit or not. So yeah, I think we can always edit up that side. But maybe just a follow-up question on that, right? Are there any
yes.
specific legal or administrative requirements that we need to open a service or a practice? Or do you just say, hey, I'm a doctor now, let's go for it?
No, man. I think if you studied at a dental institution or maybe a health institution, what they teach you there, it's also ethics. You need to know your laws in a way. So once you become a dentist or a health professional, there is one thing that you sign, which is an oath. You sign an oath, basically, which just tells you that you need to operate in this way, you can't breach these laws, you can't do 1, 2, 3. So as soon as you are a doctor and you are registered to HPCSA, which is like a governing body for all health people, anybody, whether it's a nurse, whether it's a therapist, whether it's a physiotherapist, whatsoever, all those people are under a governing body called HPCSA, right? Health Professional Council South Africa. So yeah, as soon as you have that certificate from them, you can literally just open anywhere and everywhere. And as much as you have the funds for it and can buy your materials or equipment. But again, as I said, you study your laws really at school, because there's just a specific course called ethics, which you can even apply for it now anyway. Ethics can never really, laws are always changing. So you can never really say, no, I know all the laws now. So you can always just, update yourself. You can always just apply to these schools that deals with health ethics in a way. So yeah, man, I don't think there are any illegalities as much as you are qualified and you are a legit dentist or a doctor or any health. As much as they do, because I know nurses cannot really open a surgery, but maybe they can open a clinic. Some people, like a dental therapist or an oral hygienist, they can't even open their own surgeries, you know. So it's just a matter of what do they allow according to the HPCSA rules, also the ethical rules and things like that. I wouldn't say there's anything specific, but as much as you're qualified and you know what you're doing, then you can always open. You just need a certificate from them. HPCSA, you need a certificate from.
Okay.
Yeah.
Maybe just like the last question around your practice, right? I mean, what
Yeah.
should I know about the startup capital and potential challenges, and maybe some of the benefits of owning your own practice? I mean, apart from just you call the shots on your own.
Yeah, yeah. No, man, the challenges, I would say, as a qualified dentist and you are new in the game in a way, you don't know a lot of things, man. You don't know how business runs because it's a real business when you get there. So you don't really know how medical aid operates. You don't know how to treat patients in a way and things like that. And you don't know how to hire people. You don't know how to, how much you should pay these people and things like that. So I think you always need structures like an accountant on your side, a lawyer on your side, all these other disciplines that can really, really advise you on how to go about contracts, basically, how to go about maybe the labor acts that they impose on you from the government and things like that. So those are just the challenges because you can really just start a business and say, I'm well established, everything. But if you don't know nothing about the labor stuff from the government that they impose on you, you won't know about the minimum what is this minimum wages that they enforce basically. So you might find somebody coming into your practice saying, hey, these employees, you are basically paying them way lower than they should, and then they impose fines on you and things like that. Even these HPCSA guys, you just really need to do things that are on your scope. If you're a dental therapist, you can't do things that are way over your scope because when these HPCSA guys come through, they might even take your medical license, things like that. You understand? So I think those are just some of the challenges that you would encounter if you are just going to start. You obviously need a lot of advice from guys that have done it before and just from those disciplines that I mentioned. Say, at least an accountant, at least a lawyer, at least, just to guide you through all these things, because as a young, and just how to spend your money, man, like how to invest in your business. I know when I started, I had a lot of debt because I thought I was making a lot of money, but I wasn't really investing in my business in any way. And all of a sudden, I'm owing 1, 2, 3, 1, 2, 3. So I was way, way, way behind. I had to cover all those expenses and then start making my own money. You understand? So those kind of things. I would say the benefits really is that one benefit is money, man. It's money. So your money is obviously governed by how many people will come in your practice. So it speaks to a lot of marketing. You really, really, really need to market your place, because in government, it's a fixed amount, which you will get at the end of the month. But as your practice is growing, you get to exceed that amount. And the good thing, again, is that medical aid pays you every week, basically. So you might find one medical aid gives you 20K this week, another medical aid will give you another 20K the next week. So I can't say you can really plan around your stuff, but like I'm saying, if you have an accountant, then they can help you manage your own finances nicely. You understand? So those are the benefits. Obviously, you are on your own boss, so you can You can pretty much dictate when do you want to go to work, when do you want to stay home, but you always just need to know if you're not working, you are not making money. So the bills will be piled up at the end of the month, and you were just resting in bed. So you but there's just that advantage. Let's say you want to do something else out of dentistry, you can just basically book your day off and go attend maybe a meeting with somebody or for a potential business plan or potential opportunity which can bring you a lot of money as well. So yeah, I would say those are some of the benefits. I think the baseline is you will always strive to make more money than they would pay you at the government or something like that. And yeah, there is real money. These medical aids do pay. If you see enough patients, you will get your fair share of money, man. There is no way.
Nice. Nice. Uh, I mean, you spoke about some of the challenges that one could come across, and one big one that you talk about is hiring and labor laws. Have you ever been in
Yeah.
trouble? You don't really have to take us through the names of the people. You can just give us a scenario and maybe how one could sort of get out of such, if obviously you can share. Have you ever been in trouble in that regards, or maybe what's one trouble or challenge that you sort of came across that became a
Okay.
big
No.
stumbling block for your
I've
practice?
Okay. Sorry.
Okay,
Yeah,
you
I've
can go
never
ahead.
really been in trouble, but I think I only just got a warning because, as I'm saying, I didn't know none of these things. So I give my
Mm.
employee a contract and they sign and everything. I'm thinking everything is fine. And then this labor guy comes through my practice one day. Funny thing is, I wasn't at the surgery at that time. So he started
Mm.
having an interview with my employee. How much is this guy paying you? How much? So he sort of like turned the employee's mindset to a certain point where now the employee was demanding more money from me. You understand? So I was like, no, but you signed a contract and things like that. So when that guy
Mm.
came, he had to come back because I was in there from the get go on the first day. So I had to call him back to say, yo, come back so that we can discuss these things. Let's see how we can find a solution. So
Mm.
he came, and what really happened is that he he advised me to apply from the government to say it's sort of like an exemption, minimum wage exemption, something like that, so that I can be exempted. Because what I really explained was that this is a small business, these employees signed a contract, and this is what the business can afford, basically. And then that's when he advised me to apply for that minimum wage exemption to say, okay, it means it won't apply at all. But one other solution that he basically advised me on was you can work around the wages that you are giving this employee. You can just
Mm.
work around the hours of this employee. So if I'm saying this employee works 200 hours in a month, which is basically 8 hours for 25 days in a month, then you can't pay, then you need to pay this much. But if I say, let's say this person works 15 days and they work 8 hours per day, then it means their salary does come back to maybe what I was paying them in a way. So maybe you need to identify your most busy days or months or things like that. Then you can always just adjust with your employee so that you can be able to pay them what you can afford, but they need to work a certain amount of hours so that everything then aligns. So, but for me, for my case, I just applied for the exemption and everything was fine from there.
Nice. Nice. Do you have anything maybe in addition that you would like to talk about on the practice side? Maybe some information you thought was particularly important to just share with our audience.
Well, um, what can I say? Running a business is very important, man. Like running a practice. For me, it has made a lot of wonders because then, like I'm saying, I'm my own boss. I have
Mhm.
experience. If I was working at the government, really, all I would know today is just removing teeth and That's not the only thing you want to be doing, So I got to establish my own practice the way that I wanted to work as well for the things that I also wanted to do. But really, what's important is always seek information, man. Always be updated. Always want to know. That will make you work very, very smart and not hard, and you can make a whole lot of money. What I always look at as well is specializing. I said at the beginning of the video that dentistry is very broad. So just like medicine, you have specialties. So even with dentistry, you have specialties. You are still a doctor, you have specialties. You can go on and specialize, and you establish your whole practice to a whole new level. You understand? So that's what I'm doing. I'm trying to specialize now, but yeah, I would say information is always key. Like, don't try to run this thing on your own, because there are many aspects that you may not know certain information. Like, as I'm saying, I knew nothing about accounting. I knew nothing about managing my own finances. It's very important as well to just have an appointment system, as well as maybe a call system. Most dentists are not doing this now. Let's say a patient comes to you, and then let's say you remove their tooth. Just follow up on that patient. Say, look, you removed the tooth with us. Are you okay? I think most patients really like that, because most dentists are not doing that as well. Just an appointment system as well, to say, you know what, we booked you at 10:30, and then you call at 10. Are you guys still coming? Should we reschedule the appointment? It really makes the patient feel like, I'm being taken care of. But another important thing, which I don't think I usually basically need to say, is just marketing. Market your business as much as you can, because that's where your money that's where you get your money, basically. As much as you might think, hey, I'm spending too much on marketing, but there is a lot of money that comes back from that. So
nice. Maybe before I close the practice topic, you have about 2-3 locations. I think it's 3 locations.
yes.
Can you maybe just tell us where they are at in different areas?
Yeah. So I have a surgery in Johannesburg. From Joburg to Alex, you use that street. It's called Louis Botha Street, Louis Botha. To be exact, maybe I would say 127 Louis Botha Street. If you put that on your GPS, it will probably show you the Joburg, Johannesburg. So another two are quite close to each other. They're like 10 minutes away from each other. The first one is in Nelmafias. It's a small town next to Mamelodi. 55 Ravens Street. Or you can even put Corner Alwyn and Real Rovers Street in Nelmafias, Pretoria. And the other one is in Mamelodi West, basically. Most people from Mamelodi would know there's a new mall, Tshwane Mall there. There's a small sort of like a complex called Den Lane. It's towards Mamelodi West. So again, next to a very, very famous road called Samaya Road, there's an engine garage there, which is the only engine garage on that street. So to be exact again, maybe with the location, I would say it's corner Eerste Fabriek and Buffalo Street in Mamelodi. Those are the 3 locations.
Nice. Thank you very much. I just wanted to make sure that people get to know where they can get some of these practices, right? But now let's go back to the interesting stuff.
Infinity Smile.
Infinity Dental. Smile, yes.
Yeah.
Okay, nice. I'll put some links as well on the comment section, just so that people can also follow up them. But I would like us to go back to the interesting questions, right? What is the main cause of bad breath? Even if maybe you sort of, brush your teeth, what causes that?
Yeah, so it's very, very important to clean your teeth at the dentist. We spoke about teeth cleaning as one of the services that we offer, in fact, each and every dentist. So what happens is that with the food that you eat every day, obviously you will say, look, I'm brushing my teeth every day. Maybe I even use a mouthwash and things like that. But I still experience a lot of bad breath in my mouth, things like that. So first of all, bad breath can come from you not brushing your tongue. When you brush your teeth, you need to include your tongue as well, because your tongue can have a lot of germs that can bring out the bad breath, even though you clean your whole other teeth. You understand? So just need to brush a little bit of your tongue, then I think that would be enough. But second of all, as I was saying, with the food that you eat every day, there are certain areas that your food go there and get stuck, particularly in between your teeth, also between your teeth and your gums. You understand? So if those foods are not being removed by the dentist, because your toothbrush is not going to reach those areas, even though you are brushing 2 times a day and things like that, those foods over time, they become what we call plaques. They become very, very hard. So you will just find maybe your gums starting to bleed or things like that. It's because those plaques, they start to irritate your gums, so your gums will swell, your gums will bleed on the inside. It's not a bleeding that you will be able to see. So obviously, if you are just bleeding, if there's a lot of blood in your mouth and it's not properly cleaned, it will smell very, very badly. Even if you can make an experiment, you put some blood onto a bottle, after a few days, that blood will be smelling horribly. So just imagine that in your mouth. You understand? So those plaques are what causes your gums to bleed, your gums to swell. Sometimes you might find that your teeth are starting to become loose as well. It's because those plaques, they then damage your bone around the tooth. So each and every tooth sits on a bone in a way, because your jaw is bone, obviously, upper and lower. So those teeth are embedded in bone. So if those plaques are starting to cause irritation to your gums, they then start to cause irritation to the bone around your teeth, which is basically covered by the gums. So your teeth will start to become loose, and in that way, that's what we call periodontitis. So you need to clean your teeth regularly to avoid all those things that I just mentioned to happen. So we always advise our people to clean 2 times a year. So each and every 6 months, as soon as those germs are starting to accumulate with just the normal food that you eat, you always just need to go to a dentist to remove them, because like I'm saying, there are certain areas that your toothbrush cannot reach. And those are the areas that as a dentist, I'm targeting to clean. So bad breath, mainly, it comes from that. But especially with the bleeding that happen on your gums, because you are not cleaning your teeth and there's a lot of plaques that are just accumulated there that you are not really doing anything about. And when they are plaques, when we call them plaques, your toothbrush cannot even, it's way too hard. Your toothbrush cannot even scratch it in a way. You understand? So very, very important to clean your teeth at the dentist, not just with a toothbrush. And 2 times a year, which is 6 months. Even medical aids these days, they allocate your funds according to that. Like they will say, you have let's 1,600, but you are allocated 800 for 6 months and another 800 for another 6 months. So they are just basically encouraging you to also ask dentists to say, you cannot take this whole 1.6 amount, but you can take it in 6 months intervals. It means this person must come 6 months to clean, then you can access that 800 rands. And then after 6 months, if they come to clean, then you can be able to get. So it's not a matter of I will clean the whole, the whole 1.6 and stuff like that. In fact, one other thing that I didn't mention in terms of challenges is how to claim your money from the medical aids. You need to know how to claim from these medical aids. You need to apply with them. Because how do you then get your money if somebody comes with a medical aid and did the treatment? So those things are very, very important. Those are some of the challenges, because I also didn't know when I got into the business, but
Mhm.
Fortunately, I had somebody that I could ask and they could set that up for me. And I had to learn as I was going how to then do it myself. Things like that can be a very big challenge. But in terms of bad breath, you need to clean your teeth. If you clean your teeth every 6 months, I guarantee you, the bad breath is out of the window. You won't complain about it.
But I mean, bad breath is not the only challenge we experience in our mouth, right? Sometimes we do
Yeah.
have this Kaiser chips type of a teeth. What normally causes that? You know, when your teeth starts becoming too yellow and stuff like that. Is that the normal color of my teeth, or does it mean that maybe I'm eating a lot of raja in some way?
There are two things to that. Sometimes, I mean, as people, we are not the same. Sometimes it's just a natural color of your teeth that we cannot really do anything about. Maybe we can consider things like teeth whitening if you want your shade to be, a little bit whiter than what it is now. But there are certain conditions, man, like as an embryo, maybe in your mother's womb and things like that.
Mm,
Development
mm,
in the mother's womb, I would say maybe just how your your mother, if I could put it that way,
mhm. Sure.
sort of like treat her body and everything like that. I mean, things like smoking can basically just cause some of these teeth problems. But it's not only teeth problems, to be honest. You might find that also the face is skewed and things like that. But in terms of yellow colors, it can then cause that as well. But again, there is these areas, some areas you might find that the water there that they drink, it's a little bit salty. I don't know if you've had that concept. Yes, so
Mhm,
most areas in particularly rural areas, they try to clean their water way too much. So they applied what we call fluoride. Fluoride is just an ingredient that you find on toothpaste as well, and things like that, just to make your teeth stronger, right? But if it's put too much, and which these rural areas I'm talking about put too much onto the water to try and purify it, right? It
mhm,
then, when you are ingesting it as a young person with your teeth developing, you know that your teeth develop in two ways. Like you start having baby teeth, which you will shed off later around the age of 6, 7, and then you have permanent teeth, which are then your real teeth. So if you start
mhm,
ingesting that water at a very young age and your teeth basically are not yet well developed, you start ingesting that fluoride, it has a very, very big effect on your teeth. You might find when your permanent teeth then comes, they are just
mhm,
yellow and brown. And that just shows that these teeth are now weak because they were exposed to too much fluoride at a very young age. So some of these things are things that happened because of the environment that you come in, that you come from, or sometimes it's just natural teeth, sometimes it's also just development. So development from your mother's womb and as you were being made, things like that. So what I would then just emphasize on is just the fluorosis, the fluoride part, where
mhm,
it's just mostly I get people who has those kind of challenges who are complaining of
mhm,
brown or yellow teeth. It's just because of they were exposed to too much fluoride while they were young. And this refers to that salty water, that water that is
mhm,
not so nice, growing up in these areas. Maybe like, yeah, I don't know, Amanskral, I've had all these other
mhm.
inside there. So, yeah,
Sure.
it's not normal, but sometimes it can be normal.
Fair. So, I mean, you spoke about, obviously, just to recap, that could be caused by at birth, which means the parent that is holding you well before you're given birth to, and obviously by the water that we sort of consume. Do we have other
Yeah.
foods that sort of causes that other than just water? Because I could come with an argument that I'm not saying it an area where we have too much salty water, but then maybe since my teeth are sensitive or my teeth are brown and all those kind of things. Do you have certain foods that you are aware of that, if consumed too much, would cause maybe some of these dental issues?
No, man, I haven't heard of a lot of foods that contain fluoride, you know. But if there is, then I would say too much exposure to that type of a food that has a lot of fluoride then can then cause those. So basically, too much fluoride, anything that has fluoride. If you grow up maybe at a normal place where there was normal water and things like that, but you used to ingest Colgate itself, you know, because Colgate has fluoride. If you used to not spit out the mouthwash, instead you drink it, then those are the type of things that can then expose you to too much fluoride. You understand? So just anything with too much fluoride. I haven't heard really of specific foods that has too much fluoride. But if you are ingesting Colgate itself, I mean, what are you doing?
Too much of
You
it.
know, those kind of things can then expose you to too much fluoride. Mouthwashes have fluoride because these things are made to strengthen your teeth. But too much of it, too much of everything is a bad thing. But too much of fluoride, it causes all these yellow teeth, brown teeth, and all these kind of things. Especially if you ingested them while you were young, because I don't think they have too much effect when you have already grown and your teeth have already developed. So they target when your teeth are developing, basically. As I said, when you are young, you have baby teeth. So all those teeth, you are still yet to shed them and then have permanent teeth. So if you start ingesting those fluoridated stuff while you are young with baby teeth, then your permanent teeth may come out brownish, or they are not really structured well, or they are not developing, they are weaker or things like that. Those kind of things are what could be a problem in terms of those whiteness or yellowishness.
I think the reason why I brought this up is because there was a case in my, mostly university, starting to work as well. I used to drink
Yeah.
a lot of these energy drinks, right? And my teeth, from time to time, they would either be shaky, and then you feel vibrating, or they're quite sensitive and all those kind of things. Do I have to just assume that it has a lot of fluoride as well, or is it just the sugar that is on that, or it's just me abusing these things that it sort of affects this at the end of the day, I guess?
Look, how old were you when you were drinking all those energies? Is it something that you were now grown up, or
Grown up. I think you can just think of it from what, 19 to like 24. I think from time to time, of course, we do drink this energy drink, either with alcohol or just itself on its own and stuff like that. But the consumption of that has reduced. I've replaced your energy drink with like coffee. It's, for me, it's pretty good. I drink a lot of coffee, and then there's just a lot of water that sort of supplements that. So I guess obviously it was just me maybe abusing that.
no, I just wanted to add that sugars will obviously damage your teeth. Sugars, actually, that is sugar. I don't care whether it's energy drink, whether it's cold drink, biscuits, sweets, whatever that is sugar. Even milk itself has a lot of sugar. So all this sugary stuff, they are not very, very good for your teeth. And this is mostly what causes holes in your teeth, which we call caries, or maybe your teeth to decay, your teeth to rot in a way, in simple terms. This sugary stuff, all of them are what will cause your sensitivity of teeth, maybe, or your teeth pain, because now your teeth have holes in them. As I explained before, that each and every tooth has a nerve inside. And this part that we see as teeth is what is protecting that nerve inside. So once you're eating too much sugary stuff, let's say you eat a lot of chippies every day, eventually your teeth will have holes, and it means that your nerve is no longer protected, or it's exposed to the outside, and anything that touches that nerve, it's pain. It's tooth pain,
Okay.
something
Nice.
like that. So sugary stuff, I think maybe some of those questions you were looking to get to the sugary stuff, because they do stain your teeth sometimes. Those tooth decay that I'm talking about, they present as black teeth, or brown teeth, or something like that. which, like we said before, teeth restorations and things like that. But remember, before your teeth are painful, then you can do a restorations. Once they become painful, it's either you do endodontics
It's a
or you
different game.
remove the tooth.
Yeah.
Yeah. Yeah.
Nice. Cool. I think we got a bit deep with that topic, but I think people really wanted to know because we sort of then spoke about a very good dental hygiene routine or maybe principles that we can sort of apply with our day-to-day living. You spoke about children as they grow up, they lose teeth. Do they really have to lose teeth? And if they don't lose teeth, do we then need to take them out so that this older teeth needs to sort of come out and stuff like that? Is it like a must, or it's like, okay, a kid could lose teeth as they're growing up? And what is the meaning behind that?
Yeah, man. Yeah. Each and every child will develop baby teeth first. This is particularly just because these baby teeth are also, they are small, they are not like big teeth of an adult or anything like that. So as a young child, you have a smaller mouth, you have a smaller bone, things like that. So you need to develop at least teeth to eat at around maybe 6 months or, to a year, something like that. You start developing these small teeth, which it's really a must that they must come into your mouth, because otherwise you would grow until 6 without teeth. How would you then eat? So you sort of like need those baby teeth first, and then in time, when you're around 6 years old or 7 years old, depending on what kind of person you are, as we're all different. But yeah, 6 years old, you start shedding off those kind of teeth, because now your jaw is growing, you are growing as well. So now you need bigger teeth. So if you do not shed them, or let's say they become loose, you are like, no, I'm not taking off this tooth of my kid. It means the permanent teeth will still want to come out, but it will then come out at the wrong place, basically. You understand? So then when you grow up, you might find you have a lot of teeth in your mouth, because it's a combination of permanent teeth and baby teeth. You understand? But if you lose all those teeth, even those baby teeth are very important in the spacing. They guard the space of these permanent teeth. So as I'm saying, you notice that I'm talking about ages here, because they don't just come out at any age. Around 6, you need to start shedding off your baby teeth, and so that those permanent teeth, when they come out at a specific space. Most of the reasons why people want braces today, or why their teeth are skewed, it's because they never removed their baby teeth at the right time. So the permanent tooth wanted to come out, but it was blocked at that space because there was still a baby tooth or a disfigured tooth. So then it came out maybe on the inside. And then by the time you lose that baby tooth, maybe on the other side, everything came out perfectly. So this one will look a little bit behind than this one, which is on the level. So at the end, when you have grown up and the bone is much stronger and everything is set, then you need to correct them with braces and things like that. So it's just something that has to happen naturally. As a kid, you have baby teeth, and then you need to shed all of them to then allow the permanent teeth to come into place and well aligned for that nature.
Interesting. I didn't know that. So
Yeah.
then why do we, as old people, when we lose our teeth, why is it like gone and it's gone forever? Is it because we only get 2 chances to grow teeth?
Yeah, you only get baby tooth once you lose them. So when you have a baby tooth, your permanent teeth are still in your gums, or let's say in the bone in your gums. If you were a kid now and I was to take an X-ray, I would basically see the other permanent teeth developing, but still in your gums. They are not yet fully developed, but they are developing. So in time, when they're fully developed, that's when they erupt. So once you are now older, you don't have any more other teeth coming after that one. So once you start removing your permanent teeth, that's why we call them permanent, because they have to be there forever. You need to take care of them for them to be there in your mouth forever. You understand? I've had so many older people who has never removed their teeth in their lives, but I've also removed teeth from younger ages just because of how you treat your mouth, how you treat your teeth, how you clean, and all these kind of things, which is very important. So yes, you only get two chances if I am to answer your question. You only have the baby tooth first, which naturally must shed off, but then the permanent tooth is the last tooth that you will have. Once you lose that tooth, you will have a gap forever. But one of our services is teeth replacements, fake teeth, dentures. You've seen our grannies wearing dentures, putting them in a glass or something. But we also have permanent things like implants and bridges, permanent teeth replacements. Once you lose your tooth, we can basically replace it with a fake one so that it allows you to still eat, to still speak, and things like that. So, yeah.
Fake teeth, do you have to keep on maintaining them after you've installed them, or you guys just go straight and then install it and then it's now we're gonna just move with your mouth and your normal day-to-day hygiene?
It really depends which permanent tooth it is or which.
Okay.
It can be removable, it can be permanent. So, but to maintain it's just, I would say, depending on which type of, let's say you did an implant, you basically do need to maintain it because this is something that's in your bone. If any infection does happen, then you might even lose that bone there. So you always need to go and check, okay, is this thing still sitting properly? Is there any risk of infections? Is there any? So those maintaining parts, I would say it's very necessary. But if, let's say I made you something removable, I don't think you really need to maintain going to a dentist. You just need to clean that removable piece of yours or teeth of yours. As much as you clean them, remember it's something that's coming from outside into your mouth. So as much as it's clean, then it does not cause any problems in your mouth. But if it becomes dirty, maybe from germs outside your mouth and stuff like that, it's more of like you are now bringing germs from outside into your mouth, and that's when it will affect your whole mouth basically. So maintenance is more for permanent teeth replacement. But if it's something removable, it's still fake teeth we are speaking about. You just need to really take care of that unit that you have or that fake tooth that you have so that when you put it in your mouth, it doesn't cause any more problems into your mouth.
Maybe we have been talking a lot about the information around dentists, right? Do you
Yes.
have any case wherein maybe a doctor, right, did a very bad case or a very bad procedure to maybe a client or patient, and that you maybe can share with us here? The point I'm trying to get here is everyone posed as a specialist and everyone posed themselves as I'm the best of the best in this industry. But sometimes it might not be the case. It might be that you're not that good in whatever procedure you need to do on a patient and stuff like that. Do we have some of these things that can show us early that, okay, maybe my doctor in this case might have done something wrong? Or maybe do you have a case where you can share that you know of that has happened around maybe bad procedure by a doctor?
Yeah, I think, look, man, each and every procedure, especially anything surgical, a simple thing as just to remove your tooth, it's something surgical on our side. Those kind of things always have complications. You can never know after you remove this tooth what will happen to this person. So there is a lot of challenges, even just teeth replacements, as we were speaking about. There can be a complication there. So I'll just give you maybe one case of something permanent replacement and maybe a case of an extraction or something that I once did, things like that. So in terms of teeth replacement, when we say we are doing teeth replacements, obviously this is a fake tooth. This is not something that will be This is not something that is part of your mouth. It's something that we are introducing into your mouth. So some of these challenges happen when there's a certain glue that we use to sort of like really make this thing permanent, right? So sometimes patients, those teeth may fall. Let's say you are speaking, you told a patient that this is a permanent tooth and it's supposed to be permanent. Say the material that you used was not really that strong, or let's say while you are preparing, you didn't really isolate much, you didn't really make sure that everything was perfect while you were installing this teeth. So if you do not do everything perfectly according to what it's supposed to do, those teeth may fall. You might find it's somebody who at work they speak a lot, and say you're speaking to a client, and then those teeth fall. Obviously, the confidence just goes from, you know, and then now they have to come to you and say, "Look, you told me this thing was permanent, it was never gonna fall," things like that. So how did this thing happen? Those are where the complaints can start. But sometimes you can do something perfectly, but the person's teeth really just can't hold this thing. And you can try 2, 3 times and these things keep falling. It means that there is basically nothing you can do. I mean, we are not gods where some of these things we have no control of, you know? Yeah, so that's some of the complaints that I've also gotten from clients. But also when it comes to removing a tooth, a lot of complications mostly happen after, because there is a lot of diseases that people may have that may affect the healing process of after removing a tooth. So some of these things may be that when they get home, they start bleeding too much, and everybody knows it's not safe to just bleed too much. So just from a simple extraction, you can have a hemorrhage, you can have excessive bleeding that you may not be able to control. And with those cases, always advise patients to hit the nearest hospital. Anywhere that's open, that is a hospital, because obviously they have professionals there who can handle these kind of problems. But then again, on a dentist side or on a professional side, if you do not know your job, by just there's a lot of nerves that runs through into your mouth. You can damage those nerves and you find patients say, I can't feel this whole side anymore. And once you damage a nerve, you can never repair that. So it means you have now caused the patient to just die one side. They cannot feel, the lip cannot hold the saliva, all these kind of things. If you really do not know what you're doing, that's why these fake doctors are being caught a lot, because then patients go back with complications, and now when it becomes a big thing, these people cannot show their qualifications for it in a way. So then it becomes a very big problem. There's a lot of complications that can happen, severe pain. If I tamper with your bone, you may not sleep for days because of pain. So it's very important to just take care of the patient. If you suspect that, okay, this was a difficult extraction, or maybe this was a difficult surgical procedure, just to give those antibiotics and painkillers to care for the patient, because you suspect that there might be a lot of pain on this patient. Allergies. There are people who, when they have allergies, they are very, very, they can basically die on your chair. The airway can close up and things like that. So some of these medications that we use, injections that we use, some people may be allergic to. So it's very important to just ask if any patient has allergies of anything. If it's obviously most people may not know what they're allergic to, but it's always okay for you to ask and make sure that whatever you are giving to this patient, whether it's medicine, whether it's an injection or a material, restoration, whatever, these persons are not allergic to, because it can be very dangerous.
I mean, I really like how you spoke about the doctors who cause trouble and then they cause more trouble until obviously the case gets to be a bit more worse. And I mean, and Zoe, you spoke about the doctors who follows up to say, hey, are you still fine? And Cool, and
Yes.
then they sort of just make sure that they oversee their patients throughout. That is very interesting. Which I think maybe for me, an advice to people listening here is if you happen to have the first procedure and it's quite complicated, maybe sometimes it also helps to get maybe a second opinion, more especially if you sort of assess on how it got complicated.
True.
If it got complicated because you are the one who broke the rules that the doctor told you, then probably you are the problem. They just go and fix it. But
Exactly.
you never broke any rule and stuff like that. It's quite important because I think people then now go and look for second opinion while it's very, very, very late.
100%. Nailed it.
Yeah. Just to ask, right? This is the
Yeah.
second last question, right? Do you guys
Okay.
have these things of levels wherein you can say you have a junior dentist and then you have an intermediate dentist, you have a bit more senior and all those kind of things? And what is that one thing that then describes that, okay, I'm at a senior level and all those kind of things other than just the years of experience of working?
Now, the levels that I would say is it's
Mm-hmm.
either you are a general dentist or you are a
Mm-hmm.
specialist. So, as I
Okay.
said, dentistry is very broad. There is endodontics where you
Mm-hmm.
mainly just work inside the tooth. As I said,
Mm-hmm.
like the nerve of the tooth. So your job is basically knowing how well you remove that tooth nerve and you restore the tooth on the inside. Things like braces. Braces, people are specializing for that, just to deal with how your teeth move, how you align teeth. It's a specialty on its own. So
Mm-hmm.
when I'm a general dentist, I can do just a little bit of everything, but I also have a scope. I cannot go over some cases. I cannot do some surgeries. You understand? So
Mm-hmm.
only when
Mm-hmm.
you are a specialist, then you are basically when you are a specialist, you might not even need to restore a tooth. Those are stuff for the dentist. Those are general stuff that most people complain of. So the only two levels that are there. Once I'm qualified, I am a dentist. I am basically a dentist, but I need to do more, sort of like study more years to do a specialty. It's just like a general
Mm-hmm.
doctor. If let's say they are a general doctor now, you can say I'm a junior doctor. Obviously, with experience, you become more experienced. There are sort of like levels where if you are grade one, let's say they will say you are a doctor, but 1 to 5 years, basically. But if let's say you have more than 5 years experience, they just give you a grade two sort of like rating. But that is only important in the salary that you have. Because if you're working in a government and you're a grade one, you earn this much. But if you have more than 5 years experience, for example, and you are a grade two, you earn this much. If you are a grade three, you earn this much. So maybe those are just the gradings, but you are still a doctor. You can still do this very same thing that a young doctor can do. It's just that you have more experience and your salary, you need to be rewarded for that basically. But on a dentist side, there's also those gradings, but to really differentiate this person is really senior than me as a dentist, they need to have specialized. The biggest one
Yes,
is
something.
maxillofacial and oral surgery, where somebody basically you focus on the face and the neck, head and neck. So that's when maybe you can work with somebody who did neurosurgery. You can work
Mm-hmm.
with somebody who did ENT, which is ear, nose, and what I don't
And
know that
throat.
specialty for
Throat.
me, but ENT, yeah,
Yeah.
ENT, yeah, ear, nose, and throat. So you then start to work in conjunction with those kind of other specialties, just because you are also a specialized basically dentist. So you are no longer really called a dentist. If you are a general doctor and you specialize in cardiologist, you are not really called a general doctor. You are now called a cardiologist. But
Cardiologist.
people will know that you just specialized in cardiology. You understand? So even with dentists, if I'm a dentist, I can be graded, but if I really need to be a senior than a dentist, I need to specialize at a certain specialty. Then I'm called that kind of specialty, but people who know will say, okay, this person is a dentist, but at a higher level. You understand?
Can I then summarize it in terms of your levels? It's like, okay, as a general doctor, you can do these normal day-to-day things like whitening, bleaching, patching, removing, and
Yes.
all those kind of things. And when you start going to specialty, that's where you can even now start doing surgeries and then open and then restructure your jaws and all those other, a bit more complex
100%.
stuff that wonderful. Okay. So then why do you guys like calling yourself practicing, and why do you call it a practice? And why is it a practice forever? Are you still figuring it out every day? Are you sort of trying to stay in the safe area and stuff like that? I mean, I've seen, hey, I'm practicing this. You are practicing on my body.
Oh yeah. That's just a word, man. That's just a word. It's like, obviously, if I'm a dentist or I'm a doctor, when somebody comes to me, I have to perform a procedure, and in health terms, it's just called practicing. You are practicing
Okay.
this specialty or whatsoever. It's not really that you are practicing in a word, it's just that you are performing, basically. This is what I do, or this is what I perform on people or on teeth or whatsoever. So that's why you will hear words like, hey, you opened a practice. But they just mean you open a surgery, you open a surgical place, you understand? So
Okay.
practice, you must just equate it to a certain sort of surgery. I'm performing a surgery.
Okay.
So it just, in health terms, we always call it, I'm practicing 1, 2, 3. I think also maybe, I don't know, maybe in law or something like that, you might hear people say, I'm practicing this type of law or something like that. It's just, I don't know, it's just a word, man. It's not that we are practicing to be the best, but I can be the best, but you say I'm practicing 1, 2, 3. Yeah, it's just a word way. In health terms, we call it that way.
Interesting. I think we can talk a lot of things around here. I'm pretty sure we can even go to other different strands as well in the dentistry space,
Yeah,
right?
yeah,
But my last question that I have for you, and I'll give you a chance as
yeah.
well to ask me a question as well after. It's people. There is this thing that we call wisdom teeth. I mean, when do people get them, and why do they come very late? And is it a myth or a fact that they really come with wisdom? Does that mean that we are dumb throughout the years?
I know, man. I would say also it's just a word that it was given to those kind of teeth. I think maybe because they come late, so maybe we assume at that time you already have a little bit of wisdom, because maybe at age 16, 17, you already have all other teeth in your mouth, but they only come out around age 21 or maybe 23 with some people. So just assuming that at that time maybe you have a little bit of more wisdom, then you call them wisdom teeth. But it's just basically the third molars. With our dentistry stuff, we have molars, we have premolars. So molars, as I'm saying, at 16 you have already all other teeth. So basically you have two molars in your mouth. So the third one that comes out late is what we call wisdom teeth. And those teeth are what gives a lot of people problems, because as I'm saying, they come out late, and by that time you might find that all other teeth have occupied the whole space in your mouth. So when that tooth comes out, it might not have space. So sometimes it might come skewed, sometimes it might not even appear in your mouth, but it's there inside your jaws. That's because maybe it's blocked from erupting,
Yeah.
because now your teeth have filled all other spaces in your mouth. So, but in terms of the word, I would say doesn't really say you have more wisdom, or because those teeth will always be there. With it's just that with some people, if they do not have enough space in their mouth, they may not come out. But it's not that they are not there. They might still be embedded
I
in the
see.
bone. They just didn't erupt into your mouth. But for those that have them, it's good. Maybe they have more wisdom than they did, but For us, we always just call them fed molars, and those are the most problematic teeth. Even when you have to remove them, it's like because maybe the space is not there, you don't have enough time, and they are at the back there. So it means also the client needs to really, really open their mouth so that you can have access to having any treatment on them, things like that. So, but I wouldn't equate it to having too much wisdom or anything. It's just a word. For us, we call it fed molars. That's it. We leave it there.
I was actually assessing myself as you were talking to see if I have the third molars as well. But I think I remember some few months ago, I did feel some pain, and I think that was the time when I was really getting my wisdom. I guess the whole time was quite dull. It is quite fascinating what the science that goes behind our mouth and the teeth and just the dental life cycle and stuff. Throughout, I've just been throwing at all the questions that I've been given to ask you. Right now, I want to just give you a chance to ask me a question if you have any. It might be related to the stuff we were talking about. It could just be me. It could just be anything that you sort of maybe want to uncover.
Yeah. I just think maybe because you are in the space of, what can I say, YouTube, whatsoever, all these maybe social platforms, I would say. So maybe just equating it to YouTube, really. I know nothing about YouTube or anything like that. But as I said within this video, that I'm a very big soccer fan. How do I go about starting my own channel, YouTube channel? How to, because I would really like to just do videos and just speak about football. I'm a very big Liverpool fan, so just to talk a little bit about Liverpool. I see a lot of people doing it, but I am blank in terms of social media or particularly YouTube, because I think that's where at least you can get your stuff out there and the whole world can see. But for me, it would just be because I'm passionate about football, not for any kind of money or anything like that. I've been really trying to get information on how really can you just open your own YouTube channel, and maybe just a few tips of what you can call it and things like that, where you can start things like that, man.
Yeah,
That's my question.
that's a very broad question. Where can I start? So I mean, again, for me as well, my YouTube channel is literally around the things that I think are missing as well in the world. So I do think there is little to no content around proper educational stuff in South Africa.
Yeah.
And that's wrong or that's bad because our life literally depends on education. I mean, if you chose to be a soccer player like you wanted to in high school and didn't
Yeah.
do doctor and all those kind of things, you wouldn't have been talking to me. You probably would still be
Yeah.
depending on the parents' money and stuff like that. Same as other people I
Yeah.
spoke to. And just general, even if you're a CEO or you're a business person, whatever, all the knowledge that you have at that moment, it's just around you got the right content from the right people and it was also articulated in the right way. So I thought I should sort of do something like that as well on YouTube. But
Yeah.
maybe just a little bit of my starting story. I didn't start in the education space, funny enough, right? I started just reviewing food. Like I started just eating people food from different, these corner spaza shops and all those kind of things.
I've
And the
seen
whole
your
idea
quota
was to
videos,
say,
just eating some quota and having a review on it.
yeah,
Yeah.
it was just literally out of passion to say I see these big brands that are selling us food. They have a lot of marketing budget and all those kind of things, and that's what we're sort of consuming every day. But then there are other great people who probably are just like 2 streets away from where I'm staying, but maybe my neighbor
Yeah.
doesn't even know about them. So how can I make them discoverable by me going to try their food and then I just say what I think about it? And that's how it started, really. And it was just that simple idea.
How
And
do
I
you
just went
create a
for it.
YouTube channel? Do you
It's
just go
simple.
to
You
YouTube?
go to
There are steps
YouTube,
there
you
or
go
what?
to YouTube, there is YouTube Studio, you click on it, it will say create a channel, and then you can just upload your video. The very same way you upload the video on WhatsApp or Instagram or Facebook. It's as simple as that. It's quite simple. You don't have any registration process. Hey, wait for this, that. No, 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 no. And I think
Or
one of the
can I
biggest
upload a video that I took before, or can I just go in live there,
Yes.
record a video there, and then
No,
upload
we're
it?
not live. We're not live in this
Okay.
case. So we're not live at all. So you can just
You
literally go and
always just
upload the
need to
video
take a
date
video
later.
before.
You can do it live if you want to talk live, if you believe your content. Because I think if you're talking about, let's say, soccer and stuff, you do want real-time engagement or something like
Yeah,
that, where people be like, when your analysis are wrong or stuff like that. But all I
yeah,
can say is it all comes down to just saying, let me just do it. I mean, to be honest, if you go to my videos earlier on, the editing was bad. I didn't really know how to do the proper camera angles and all those kind of things. I just
yeah.
got to learn
You
them
learn as
over
you
this
go.
period of what,
Yeah.
2-3 years. Yeah. So for me, it's like, if you want to do it, just make sure switch on your phone and then start talking. I think the biggest thing I think many people run away from. I have this big problem with the content creators in South Africa. They're not genuine.
Yeah,
They're not genuine about their content creation.
their
They
content.
always want to.
Yeah.
Yeah, they want to be flawless. Like, I mean, right now you can see my shirt is
And
a
that's not
bit.
content. That's not, yeah,
You got what I'm
yeah.
saying? That's
I
not
agree.
content. That is stage stuff. You're acting and whatever. But with YouTube and other platforms these days, with content creation, it's like, just be who you are, say what you believe. You're probably gonna find other people who
100%.
believe in the very same thing, and then you create a community around it. But all I can say is just go and start. I mean, we can always talk about the details after this video if you want to. And I think with that whole step, we can maybe record a video or do something that we can share with
I think
others.
just you maybe I'm just struggling to start because I have been blank basically. But
Where to
I have
start?
Mr. Cator here, and he's gonna
We're gonna
help me
take it
start.
out. Yeah. Yeah.
Yeah.
Yeah. We will. Definitely we should be able to see something in the next few months and stuff. Otherwise, I think maybe that's all I sort of had prepared. I don't know if you have any other closing statement you might want to say from you, and then we can close it out.
Nah, man, I just want to tell people to visit our website, infinitysmiledental.co.za. All the information is there. You will see what we do there. You can book an appointment from the website. You can even have a link. You can even press a WhatsApp button there where you can start chatting to me or one of our receptionists at the practice there. Just go to the website, man. Check it out. Check what we do. Check the quality, maybe. And if you want to book an appointment, just book an appointment from there as well. It's very, very easy. Yeah, I think for me, that's it, man.
It was a very interesting chat for me. I did really learn a lot. And yeah, I really appreciate you for your time.